In this video, we will cover safe practices for vaccine sites to implement, the vaccine administration process, and how to create a welcoming and comfortable vaccination site. These next two slides contain information you likely are already familiar with, but we wanted to review them anyway as this information is important. We will also introduce some additional resources for your use if you would like to review them. The environment in which the vaccine is administered is an important consideration, as the experience individuals have could impact their willingness to receive a vaccine in the future or influence the willingness of their friends or family to receive a vaccine. Equally as important is to ensure the vaccine site follows safe practices to reduce the transmission of COVID-19. To reduce the chance of exposure, vaccination sites should require mask wearing for all vaccine providers and encourage mask wearing for all people, regardless of vaccination status. Try to limit the number of people in waiting rooms and encourage physical distancing. Vaccine providers should wash their hands in between clients, and if vaccine providers wear gloves during vaccine administration, they should change their gloves and wash their hands in between clients. The CDC has released interim guidance for healthcare personnel to ensure safe practices while administering the COVID-19 vaccine. The guidance can be accessed through Appendix B of the toolkit or by scanning the QR code on the screen. The Centers for Disease Control and Prevention has created a skills checklist for vaccine administration, a self-assessment tool for vaccine providers administering vaccines. The skills checklist can be found in Appendix B or by scanning the QR code on the screen. The checklist covers the following areas of competency: client/parent education, medical and office protocols, vaccine preparation, administering the vaccine, and recording the vaccine. Vaccine providers have 72 hours after vaccine administration to document the vaccination in Iowa's immunization registry information system. More information on IRIS and step-by-step instructions for documenting client records can be found in the toolkit. For many people, receiving a vaccine is stressful, and for some it's even scary. A person's vaccine anxiety can range, so we should make an effort to ease these anxieties by creating an environment that is welcoming and inviting. The National Resource Center for Refugees, Immigrants, and Migrants released recommendations on how to create a welcoming environment. Some key considerations include privacy accommodations, creating a barrier-free environment, and facilitating language access. While we will cover each of these three key considerations in the subsequent slides, the full list can be accessed in the Creating a Welcoming Vaccination Site section of the toolkit or by scanning the QR code on the screen. Some people might feel more comfortable receiving their vaccine in private. Individuals might prefer privacy if they're concerned about fainting during vaccination or if they're nervous about parts of their body being exposed. Sites in your community should be equipped with privacy screens, and every person should be asked upon arrival if they would like privacy during the vaccine. It's important to offer additional privacy to people so they know this is a normal option, and by doing this, some of the anxieties people have about receiving a vaccine can be alleviated. As mentioned in the previous video, documentation-related barriers can be eliminated by upholding the person's right to receive a vaccine without presenting any information. If you must ask individuals for information, such as the information you're required by Health Resources and Services Administration to request, do so conscientiously and remember that this request might be uncomfortable or alarming for the individual. We don't want to scare people off or turn them away because of documentation-related concerns. I advise you to refer to the toolkit for communication strategies surrounding documentation or rewatch video 2 of the series, as this information is incredibly important. Another important consideration in making a barrier-free environment relates to physical barriers such as stairs or narrow hallways. Micropolitan vaccine sites should have accessible parking if the vaccine administration requires people to park. Ensure walkways both inside and outside the site are wide enough for a person in a wheelchair to navigate easily. If sites have stairs, ensure the availability of Americans with Disabilities Act compliant ramps or an elevator. If it's possible, administer vaccines in locations that do not have steps. For more information on disability-related accessibility, scan the QR code on the screen to review the website published by the Minnesota Department of Health. It is absolutely crucial that we meet the language needs of the communities we serve. Our abilities to inform patients about the vaccine process, any side effects, the effectiveness, or just be able to talk to them is dependent on our ability to meet their language needs. In order to do this, sites should ask every patient at check-in if they need interpretation services to avoid profiling or guessing which patients might need language services. Ideally, sites would be equipped with interpreters available to meet the needs of the top 3 non-English languages in your community. However, if interpreters are not an option for your vaccine site, utilize phone-based interpretation or translation services and have frequently asked question sheets about the vaccine printed out and available in multiple languages. American Sign Language services should be available, and sites should consider using transparent face masks to accommodate patients that rely on lip reading. The supplemental materials section of the toolkit contains more information on translating materials, and translated FAQ sheets on the vaccine can be found in the CDC Communication Resources for COVID-19 Vaccines section. Additional resources will be provided toward the end of the video. Sites should also have signs outside the vaccination site or on the entry doors to clearly indicate that this location is providing COVID-19 vaccines. These signs should be easy to read and translated in multiple languages. Additionally, all signage and websites for the vaccination site should use large font and high contrast text, such as black lettering on a white background. Sites should test websites and forms for compatibility for screen readers. Resources to help with these language accommodations will be provided in the subsequent slides. Both the supplemental materials section of the toolkit and this slide provides resources to accommodate for language differences. The National Resource Center for Refugees, Immigrants, and Migrants have an abundance of resources for translations. Specifically, the Translating Materials section within the supplemental materials has resources for creating effective translations. The section more generally for the National Resource Center for Refugees, Immigrants, and Migrants within the supplemental materials has numerous resources in over 30 languages for use. The CDC Communication Resources for COVID-19 Vaccines has fact sheets available in multiple languages available for download. Additional resources not included in the toolkit that can help with language barriers include vaccine-specific informational fact sheets for recipients and caregivers available in multiple languages from the Food and Drug Administration. These fact sheets would be useful to have around the vaccine site for people to read. The CDC also has some print resources that would be useful to have around the vaccine site. Here is an example of a poster that can be customized and posted in your pharmacies. This poster is in Spanish and contains information on what a person can expect after receiving a COVID-19 vaccine. The poster can be accessed from the Translated Materials Library on the NRC RAM website, or this specific poster can be accessed by scanning the QR code on the screen. Scan the QR code on the screen to access the International Translation Services to find an interpreter in Iowa. In-person interpretation is available for over 40 languages, and document translation is available for over 100 languages. To find an interpreter for American Sign Language, scan the QR code on the slide. This QR code will take you to a Google Doc with 65 individuals and organizations that provide ASL interpretation services in the state of Iowa. The Google Doc shows the hourly rate, general availability, area of work, and much more useful information to have when hiring an ASL interpreter. If an interpreter isn't available for your vaccine site, phone-based translation services are a viable option to bridge the language gap. Some of the best apps for translation include iTranslate, which is available for download for Androids and iPhones, and supports written translations in over 100 languages and speech interpretation in over 40 languages. TripLingo is another great app that offers translation for text, speech, and images in over 42 languages and is available for download for both Androids and iPhones. Microsoft Translator is another great app that can translate written text in 64 languages and can interpret speech in 21 languages. The app can also support translation or interpretation of multiple languages in the same conversation, which sets it apart from Google Translate. Microsoft Translate is available for download for Androids and iPhones. Check out the resource on the screen to ensure your vaccination site's website is readable for screen readers. The resources provides considerations for optimal accessibility. Finally, check out the last resource on the slide to learn the guidelines for ADA compliance with signage for vaccination sites. This resource contains information on the guidelines and ways to ensure your sites are compliant with the guidelines. In the next video, we'll discuss health equity considerations for racial and ethnic minorities and immigrants and refugees.